lastly, we can move to the rescue therapy. What is the meaning of rescue therapy? Is simply meaning here is how to treat the side effects of anti-cancer drugs. How to treat the side effects of anti-cancer drugs. So we discussed all the anti-cancer drugs. Number one, cause bone marrow suppression. Bone marrow suppression. So bone marrow suppression may present as anemia, leukopenia, and thrombocytopenia. So whichever side effect is there, we can give a drug according to that. Like anemia, we can treat by giving darbepoetin. Darbepoetin is nothing but recombinant erythropoietin. It can be used for chemotherapy-induced anemia. Similarly, leukopenia, we can treat by giving filgrastim or sargramostim. So this is used for chemotherapy-induced leukopenia or neutropenia. And thrombocytopenia can be treated by interleukin 11, which is oprelvecin. Oprelvecin can be used for thrombocytopenia due to anti-cancer drugs. It is interleukin 11, and we already discussed how to remember. Use the kin means interleukin, then remove the key, and remaining is 11. So it is used for thrombocytopenia due to anti-cancer drugs. Okay, so that is bone marrow suppression. Then second, there may be hyperuricemia. Hyperuricemia. So usually along with the anti-cancer drug, we give allopurino. Allopurinol inhibit the formation of uric acid, can be used to prevent hyperuricemia. But if there is already severe hyperuricemia due to tumor lysis syndrome, then the fastest urate lowering agent is pegloticase. Pegloticase or rasburicase, basically recombinant uricase enzyme. It will metabolize the already present uric acid. Okay, so that is for hyperuricemia. Then coming to chemotherapy induced nausea vomiting. Chemotherapy induced nausea vomiting. Now, anti-cancer drugs can cause nausea and vomiting, and this can be of two types. It may be early or it may be delayed. Early means if it occurs within first 24 hours, it is early, but if it occurs late, it is delayed. Most of the cases, more than 99% of the cases are of early. Yeah? And the drug of choice for early cases is cetrons or 5-HT3 antagonist. 5-HT3 blockers are drug of choice for early CINV, and the drug names end with the cetron. Drugs like ondansetron, granisetron, tropicetron, pelonosetron. So any drug ending with the cetron, it is the first line drug for chemotherapy induced nausea vomiting. Most of the cases are early, so even if early is not mentioned, the answer should be cetrons. But problem is the delayed cases do not respond to cetrons. So in delayed cases, we have to give substance P antagonists. Substance P antagonists are required for delayed cases, and the delayed cases, substance P antagonist drugs like aprepitant. Remember the name of this drug end with petant. Petant says it is P antagonist, substance P antagonist. So examples are aprepitant, fosaprepitant, natopitant, rolapitant. So the drug name ending with the petants. Petants are drug of choice for delayed chemotherapy-induced nausea vomiting. Early vomiting, it is cetrons. If they do not mention early or delayed, it is cetrons. Yeah? Now, apart from these, we usually add dexamethasone along with these drugs. Dexamethasone also has anti-emetic properties. So steroids like dexamethasone is commonly added to these drugs. Okay, so that is nausea and vomiting. Then moving to the specific side effects of anti-cancer drugs, like we have hemorrhagic cystitis. Hemorrhagic cystitis. We discussed hemorrhagic cystitis. It can be prevented by mesna, and if it has already occurred, then treated by steroids. So mesna is used to prevent and steroids are used to treat. And which drug cause hemorrhagic cystitis? Yes, ifosfamide and cyclophosphamide. Then cisplatin induced nephrotoxicity. cisplatin-induced nephrotoxicity. So how to prevent that? We already discussed 3 methods to prevent. One, saline loading. Give lot of normal saline before giving cisplatin so that it become diluted in the kidney. Second, slow IV infusion. Always give cisplatin as slow. Never give it fast. And third, we can use a drug called as amifostin. Amifostin can be used to prevent nephrotoxicity due to cisplatin. Then we have cardiotoxicity, doxorubicin, daunorubicin induced cardiotoxicity. So we can prevent cardiotoxicity by giving a free radical chelating agent, which is dexrazoxane. Dexrazoxane is used to prevent the cardiotoxicity. Lastly, for methotrexate toxicity, which drug we can use for methotrexate toxicity? Yes, it is leucovorin. Leucovorin, also called as citrovorin, and this is nothing but folinic acid. Tetrahydrofolic acid or folinic acid can be used for methotrexate toxicity. Okay. So these are the important drugs which are used for rescue therapy, or we can say to treat the side effects of chemotherapy. Okay.